Discussions over soaring healthcare costs and insurance premiums, a major federal court case, is now focused on how some health insurance companies negotiate claim payments for out-of-network patients with healthcare providers.
And Channel 2's Ron Plants has a much closer look now at this case, which, as Buffalo Business First is reporting, now includes ECMC as a plaintiff.
Erie County Medical Center, now just one of hundreds of healthcare providers across the country, now involved as plaintiffs in this massive federal court case accusing a Virginia-based software and data analytics firm called Clarative of setting up an allegedly illegal price-fixing system on behalf of major health insurance firms as its clients as they negotiate out-of-network patient fees for medical services with the health institutions and doctors with lots of leverage.
Clarative is basically a middleman now, and they're accumulating all this data. They're using, artificial intelligence and very sophisticated algorithms to negotiate these rates. And it's an antitrust concern from the perspective of the providers.
Former healthcare executive Larry Zielinski says this reflects the growing consolidation of hospital systems and very large health insurance firms on the other side, even though Western New York is a bit different from the rest of the country in this situation, with more regional-based health insurance firms, even though Highmark is a major player with its Blue Cross Blue Shield affiliation. Clarative has denied the allegations in the court case, saying hospitals and physician groups are just charging too much to begin with for the healthcare market, and that a ruling against them could lead to higher costs for employers with healthcare plans and patients. But the Medical Society of New York State and the American Medical Association also among the plaintiffs, stating Clarative presents an unfair advantage for its client health insurance firms in the tricky out-of-network element of healthcare plans. Some estimating a potential $200 billion settlement as compared to the overall $4 trillion healthcare industry. So if the ruling goes against the health insurance firms and Clarative,
you're talking about enormous companies with lots of resources. And I could see a company like United, for example, just establishing their own version of Clarative.
A federal court judge in Chicago could hear this case in 2027. A similar, much smaller case settlement worked out recently with the National Blue Cross Blue Shield network. There were calls for a federal government investigation of out-of-network medical services fee negotiations with Clarative. No action so far. On your side, Ron Plants, Channel 2 News.